I feel like there's a fine, like a dance that you do, right? When you're on a recovery journey. And this is where I'm coming from, because, he mentioned that I'm on a different, I think Haran and I are on a different path than everybody else here who is dealing with health issues, where we decided to take our health program into our own hands and do a more natural, holistic approach, rather than doing a pharmacy overload, right? Which is what the doctors wanted us to do for different reasons. Like I have Crohn's disease, which is an autoimmune problem, but it affects every part of my internal system. When my Crohn's acts up, my liver gets really out of bounds. My gallbladder gets out of bounds. My pancreas. I am not pre-diabetic. I don't have diabetes issues, but because my pancreas does not function properly, because of my liver issues, because of the gallbladder, it's like a whole trifecta thing that happens. And in my medical journey on that, the first thing that my doctors wanted to do was take a portion of my pancreas out of my body. They were like, we're just going to take a portion of it out, the bad part that's got colic. We're going to take your gallbladder out. And when you wake up from this surgery, you are going to be an insulin dependent diabetic. And immediately, my immediate response was, so you don't want to figure out what the root of the problem is. You just want to cut out the problem and then supplement it with whatever pharmaceutical you want to put me on. You know what I mean?
Doctors never find the root of the problem.
Right. They're only interested in like that Band-Aid.
Not never, but often.
Well, but often.
Most of
right.
the time. Like
at least in my situation, that's what they wanted to do. And I was literally sitting in surgery registration. Like they were scheduling me for a surgery like in 2 weeks to do all of this. And something, this little voice deep inside of me was just like, get up and leave, right? Like, not now, but right now. And I canceled everything right then. And I made a decision with myself, which I later discussed with my doctor. So I made this decision with me first. But I decided that I wanted to find the root of the problem, because I felt like if I started there, if I started at the baseline and really committed to working on it, the rest of the things would kind of fall into place. And for the most part, I'm not going to say that I don't have Crohn's flare-ups from time to time, because I do. I have an autoimmune deficiency, so it's going to happen. Mm-hmm. But it happens in the most extreme of stressful situations. Like if my nervous system gets dysregulated for stress or whatever reasons, it'll trigger a flare-up. But my flare-ups now are so minimized compared to what they used to be, because they used to land me in the hospital on chemo grade steroids. Like they would have to immediately put me on like, a cycle of methotrexate, which if you've never been on that, it is a psychotic steroid to be on. And then they would put me on the highest doses of antibiotics, which is Cipro, which is literally what I think they use to cure anthrax. Yeah. Mm-hmm. So that wrecks your entire gut biome. So if I'm having, my autoimmune deficiency is gut health related, and you are now giving me an antibiotic that's completely obliterating my gut biome, what are you really doing for me? Yeah. Other than controlling that momentary explosion, but you're not fixing, the collateral damage that's coming out after that. Right. So I really started investigating like natural herbs, and Haran and I were having this conversation with Tanya because of her blood pressure medicine, and I immediately was like, oh, you need to start taking cayenne pepper supplements, because that cayenne pepper thins your blood out to the point that it needs to be thinned out. But if your blood needs to be thickened or it needs a clotting agent in it, cayenne will also do that. Now, here's the thing. It's not a perfect thing. It's not going to work the first time you take it. Right. You have to build that up in your system, which also comes into play with, what you're doing as a whole routine for your system. Are you getting your mineral, not just your vitamins, are you getting your minerals in? Because we're all mineral deficient in some form or another. Right. So it starts there, and then you just, you keep adding this to your routine and that to your routine. And before you know it, you're juicing every day and you're making different choices for yourself, and you're able to eliminate the pharmaceuticals that they're putting you on. Now, with my holistic approach, am I telling people to boycott their doctors and to boycott the pharmacy? Absolutely not, because they're necessary. But they're necessary for when you're in trouble. You know what I mean? If you start cleaning up your act at a baseline level and try to keep your program as natural as possible and really investigate where you're deficient, you can really change the whole entire outlook of your health with your doctor's assistance, but really being proactive in what you are doing. And that's a whole
I agree
journey.
100%. Yeah.
That's a whole journey in itself.
3 years ago, I was taking 7 different kinds of medication at a high dose. I was taking an insulin shot, taking a pill for my diabetes, 2 blood pressure meds, cholesterol meds.
Why 2?
Because that was so high. They had one was at the highest dose. They had to add another one to it just to get my blood pressure down. Today, I'm taking only 3 meds of the lowest doses of everything, and I'm not even shooting insulin anymore. All from diet. Juicing, I started off juicing too, and I got like a whole juice recipe that I put together.
Yeah, my dad was the same way because he had a triple bypass at 60, and which is weird because he wasn't really like a huge meat eater. I think he was just always kind of pushing his stress down, and he also kind of had like some kind of weak heart thing when he was younger. I don't know. He was born in 1941, so who knows what the testing was like. Point being is, I mean, he lived to 80 very well. Really managed it, but he would do the same thing. He'd always go to his cardiologist, but he'd be like, okay, I'm doing this. This is what changed in my diet. A lot of fish, meat sporadically, blah blah blah, all that, exercise, and a bunch of supplements. And his doctor would be like, that's great, do what you're doing. But he's like, he never would tell the other patients any of the stuff I was doing.
And that's the same thing that happened.
He just like pat me on the back, and my dad had never. They said it was a miracle he never came back for a second surgery because most people do, and
So I would go to my doctors, and then they would do blood work, and I would study the blood work on everything that I needed to bring down, right? So I would basically go to the doctor and just have them do blood work, and then she would tell me what I needed to do, and I would just be like, all right, whatever, I'm gonna do it, figure it out on my own. So I would look at my A1C, I would look at my EGFR, my cholesterol, I would check my blood pressure at home, and then I use that, and I would experiment on different foods that I would eat to see it come down. And I would go every 3 months to get my blood work done because my kidneys were so messed up. I had to go every 3 months to make sure that I wouldn't get to a point where I needed dialysis. Now I only have to see her every 6 months.
Yeah, I would imagine keeping a food journal, because I've told you to do that before, like when you were playing with your metformin and the different supplements, to like really start keeping a food journal just to see what the effect is. Like, at 12 o'clock today, I ate this meal, and then like 2 hours later, what are the repercussions of that? Do you feel great? Did you feel sluggish? Do you feel like
do you have a finger tester?
So what she's talking about was, I went on this thing where I wanted to really see what were the effects of what I ate to how I felt. You know what I mean? Like, I literally can know and tell how my body, and see how my body reacts. Now, I was at your house yesterday, and I went overboard. I had 2 hot dogs, 2 burgers.
Oh my God!
I went hard, and I did not have I didn't have any of my medication with me, right? Because I usually take it and put it in my pocket and take it. You know what's so funny? 2 hours after I left your house, I was yawning, and I knew that my sugar was high, because anytime my sugar is high, I get tired, I get sleepy.
Yeah.
And I knew for a fact that I had way too much meats, I had way too many carbs.
What was your sugar?
I didn't check it till later because I hadn't gone home, because I don't bring it with me. But for the rest of the day, I mean, I ate some nachos, but I didn't even finish it. But that was later. I think it was like 6 o'clock. But
wasn't that tequila that made you tired?
Yeah, no, it wasn't. It wasn't the tequila. It wasn't the tequila. But it's crazy how, and I want to lead into a question about this, is that I know things, because I don't know if y'all noticed, the last burger I ate, I only ate like, I took off one of the. I do this. It's weird. People look at me when I do it in restaurants. So I'll take off the biggest slice of the bun and use the smallest slice of the bun, and I'll have like one slice of bun, cheese, and then the patty, and I'm eating it like that. It's weird. But anyway, so how has things changed? I know we talked about you've changed your diet, you've changed it. So let's talk about how has your diet changed? How has your mentality changed? And how are you dealing with this new lifestyle that you have to live?
Okay. The diet change made a humongous difference. Like I said, they wanted me to be on insulin, but I didn't really want to be on insulin. So they gave me metformin. They was like, you got to start taking metformin right away. I started off maybe 14, 15 different pills. And over the course of just straight focusing on fruits and vegetables and not meat, shall I say processed meat, because I do hunt. Well, I used to hunt, but I still will eat meat that's processed by my club. We'll kill it, skin it, do everything all the way down to the plate. So I know what it was, how I was treated. Mm-hmm. No, nothing added to it, no additives. So I will gobble that up. But the straight just going from a full ribeye steak to a piece of watermelon that size every day, and just incorporating the fruits and vegetables, took my A1C down to 6.5 in about a year. And my doctor, when I get my vitals measured at least once a month. At one point I was getting all my vitals once a week. Everything was off the charts. Bad cholesterol was terrible. Good cholesterol numbers were terrible. Blood pressure, everything is terrible. 3 weeks ago I went and had my blood drawn. The only thing that had increased was my A1C went from 6.5 to 7. Everything else is normal. Everything else is in a normal range.
That's amazing.
That's good.
I never took the metformin, even after the hospital. I took it in the hospital, but I just didn't really take it. For some reason, I just didn't take it. And I got it down. And my doctor she said, what did you do? Because the metformin and everything else I prescribed you wouldn't have brought your numbers from the 9.4 to the 6.5 within a year.
Isn't that interesting that she says that too? That it would take longer to bring it down. With
so my question with that is, just to piggyback, is what is the point? What is the point?
I think the point is they help you manage.
Yeah.
Right.
You have to do your own.
That's it. There's
it's
no
not
fixing.
a miracle.
You have
Right.
to fix yourself. You have to fix yourself.
You have to change.
So a lot of people will go to the doctor and then they would say, they would get prescribed some metformin and they would just take it. They don't ever think that they can reverse things. And that's the problem. And doctors automatically assume when they come in, they're not going to reverse it on their own. They're not going to ask them, so what are you eating? Well, they're going to dig into that. They're just going to be like, here's a pill. That's going to solve your problem.
Well, in the beginning of you taking your metformin, that's literally how you took it. You were like, I'm going to eat this whole cheesesteak. I'm just going to pop my metformin pill afterwards.
And
like
that's
that's
balanced,
literally
right?
how
You're
you were.
balanced
Yeah.
out.
That was the literal ignorance in me. We're like, oh well, I got a pill for that.
A lot of people think like that,
Yeah.
and that's
Yeah, they
the
do.
crazy part.
Well, I got a question or maybe a statement. So, and I don't want it to sound weird, but I'm going to say it anyway.
Oh, make it weird.
It's probably going to be weird.
My nipples are hard.
If you knew how many times I've heard that, no, I'm just kidding. So anyway, I was sitting here, I'm listening to you, everyone talk or whatever, and I keep thinking, and this is a black problem, especially a black men problem. One is, y'all don't like to go to the doctors until it's too late. That's number one. And two, we have
That's a
not
man
been.
problem.
I was gonna say that.
It is a man
It's a man
problem,
problem.
but especially in the black community. One, we don't have the education behind it. We don't have the finances, like they might not have health care or something to do it, or even the time. If you're
And
financially strapped,
distrust.
you don't want to stop and go to the doctors because you got to feed your 5 kids. You know what I mean? So you choose you prioritize your health in the least amount. I think it's in general. I think it's definitely a man thing, but it's higher for black men. And I'm only saying it because I obviously witnessed it being black.
It's true.
So I think this is really a good conversation because one, you're obviously a black man, obviously, but
Maybe that's not how
Are
he
you sure?
identifies, Tanya.
yeah, he may not identify as that.
Nah, I'm brown.
This ain't that show. This ain't that show.
Look, we don't want to get canceled. We have to be politically correct, okay? No, I'm just kidding. But seriously, do you think that, my question is do you think any of those things played a part in you not taking your health seriously? Because you already said that, you knew as a child that there were some issues with yourself.
Yeah, as a child, I was told I probably wouldn't make it past 30 by a professional.
So then you don't care. You're like, oh.
Exactly.
Oh, so you decided to live life to the fullest until then?
Until then, yeah. And then when I got close to 30, I didn't really feel like I was going to die at 30, and it just kept going. So at that point, I just kept going.
You're like, I beat that professional. Whatever.
They were wrong.
Mm-hmm.
I have a question. Everybody has a healing journey to go through, and for everybody that looks very different, right? For you, it looks different. For you who has experienced loss and witnessing, sickness, healing, all of that. We've all done that. We all go through our own. It's almost like exercising inner demons while you're going through the healing process because of all the things that you weren't doing before, all the, treating your body like it's an amusement park along the way until you get sick, and then all of a sudden you got to take shit seriously. What has the healing journey for you been like? Has there been depression? Has there been doubt? Has there been good moments, like aha moments where, you're like, oh, wow, I can do this?
There have been aha moments, far and few between. One thing that I've never heard of, and I don't know if it's discussed, but heart attack, also known as myocardial infarction, and depression become best friends.
Yes.
Yeah.
Best friends.
Oh, yeah, we haven't talked about the mental health part of this for you.
Mental health is untalked about. I am blessed and lucky enough to have my primary physician is a female, but she took a class or study led by a physician who was a male who had a massive heart attack. And the whole course was about the mental health, the problems that come with it that are not discussed and are usually not dealt with. A lot of people don't survive heart attack at the level of what I had. If there was like 5 levels, I was level 5. So not having any complications, I can only imagine is probably not much better than what I went through, but having all the complications that I had to deal with, I couldn't begin rehab for over a year, and they wanted me to go to rehab right away. But I couldn't walk. I couldn't walk for 7 months instead of the 7 days or the 14 days. I couldn't, when you, everybody here is looking for air right now. Everybody here needs some air to breathe. I'm struggling for 2 years, every day, every night. I wake up looking for air. They put a machine on me. I woke up 48 times. I stopped breathing 48 times throughout the course of the night. Mm-hmm. But I don't sleep. Insomnia is a big thing for me to deal with. Still. I still deal with insomnia. A lot of things have gone away or I've suppressed and dealt with. But the insomnia and the depression, the rapid thoughts that your brain goes through is mass confusion to the nervous system. Because my brain can't, when you go on, somebody tells you you're going to have a surgery in 2 months, 2 weeks, 2 days, 4 hours, you have some type of mental capacity to say, oh, okay, I'm getting ready. I've had 6 surgeries before this, so I've gotten ready. 2 of them, I had issues with anesthesia to where I didn't wake up for like 4 hours after I was off the anesthesia. So I've dealt with stuff, but going into this blind, and when you come out and nothing in your body works, I mean, nothing works, and you're just there, and they send you home, and nothing works when you get home, and 4 months later, nothing's really working.
Do you have children, family?
I have a wife and daughter.
Did they give you any medication for your mental health?
Eventually, but I had to reach out to let them know that I was unhealthy mentally. I had to call the 1-800 number. I had to call my doctor one night. I called him at like 4:50, and I was like, I can't do this no more. I'm done. And the lady, I knew the lady who answered the phone. She said, "Keith, what's wrong?" I was like, "I'm just done. I can't think. I don't want to do anything. I don't want to do anything." And she said, "The doctor just left 10 minutes ago, but I'm gonna call her and tell her." And this is my primary physician. She's been by my side, and she called me like 8 o'clock. I was like, "You need to call this number and tell me." And she said, "Tell me what's going on." And I was like, I can't compute things 90% of the day.
You're tired.
I can't. I'm tired.
Mm-hmm.
I'm fatigued. My brain I can feel my brain telling my body to do something. It's just no connection.
It's not responding.
No response.
How did this affect your wife? I'm sorry. How did this affect your wife and daughter? And
hold on, before you answer that question, I'm sorry. Do you mind talking about your episode 2-3 weeks ago when you called me?
Oh yeah, I was just at a point where you go up and down, of course, but I'm down a lot, and I've never been this down for so long. And when you get uncontrollable thoughts, the things that'll make you excited can also make you sad. I got 3 dogs. I love them dogs to death. And sometimes I just look at the dogs, and I'm supposed to be happy because they're my therapy, but I can't make myself feel happy. And then all of a sudden I feel happy. And then something else makes me sad. Something else makes me mad. And something else makes me confused. The state of confusion is probably the worst part. Because I have to manage what I do. And I've come a long way. And it's hard. And when when you're up for 4 days, you're thinking. And when you don't sleep for longer than an hour and a half, after 4 days, I sleep in hour successions. I'll sleep for an hour and then I'll be up for 2. And I'll lay down for another hour and I'll be up for 4. And then I'll be up for about 48 hours. But understanding that you have to change your life in ways that you couldn't think of. You never even thought you'd have to change your life. And there's no turning back for me. I can't go back to what I used to do. I can't go back to feeling the way I used to feel. I avoid stress at all costs. But you get the feeling you're alone. The closest person to you, unless they've had a heart attack, they don't understand you. People look at me now, even when I had my numbers drawn a couple weeks ago, I went and saw a nurse practitioner instead of my regular physician. She asked me, why are you here? Because I'm required to come every 2 months for a checkup. What you mean, why am I here? Did you look at my chart? Yeah, everything's just your A1C is at 7, so we'll just increase your metformin and you're good. I said, keep reading the chart. And she started reading the chart, and 4 minutes later she goes, okay, I know why you're here now.
Wow.
Very dismissive.
Yep. And the closest person to you gets to a point where they start dismissing what you're doing.
Yeah, talk about
dismissing how you feel.
Yeah, answer her question, and I have a follow-up after that.
Yeah, your wife and daughter and how that affected the relationships with them.
It affected everybody. I was probably mean, confused, angry a lot, just mad. Why is this happening to me? Why I can't? If you're a person who's a provider, if it's in your nature, and you can no longer provide, you can't do. I couldn't do anything.
So you weren't working, I assume. Are you working now?
I'm beginning to get back into work.
Okay.
But no, I wasn't working. I couldn't work. I couldn't.
I imagine not, but
managing at that point, managing my health was my full-time job.
Yeah.
I had a nurse
I'm in the
coming
same
to the
boat.
house twice a week. 4 specialists, 3 different doctors. Appointments. Find out, then surgery, appointments. Every week, every day. It's gotten to the point now to where I had to realize I have to change my lifestyle to not have to visit these people so often.
Right.
But every week I get a call from a nurse, same time. What'd you eat? What'd you eat on Monday? What'd you eat on Tuesday? What'd you eat on Wednesday? What'd you eat on Thursday?
Do you know what's the hardest thing that I have come across is to make family understand how hard it is, what you're going through. And unless someone actually goes through, it's not that they don't care. And they can say, I understand you. You don't.
You can't.
You don't.
You can't.
You don't understand me. And if I'm telling you this is hurting or I'm hurting, you can understand me.
Yeah, it's very
and that
easy
is
for
hard.
them to be dismissive.
Yeah. It's very
It's
easy.
like, oh, you don't have cancer anymore. You're fine. Look
That's
at you.
That's not how it works.
I'm
That's
like,
not how it
you
works.
have no idea what it is after cancer.
Right. And
You know?
mine wasn't even. I sort of have a guilt of not having a worse cancer, like worse, like having, you know what I mean? Because like when I tell people, I feel guilty for telling that I even had cancer because mine was very small and I didn't have. There's nothing in my lymph nodes, which is great, but I feel bad because I know what she went through and I'm nowhere in that vicinity. So even though we both had the same thing, sort of,
Yeah.
I still don't feel like I can totally understand you.
No,
Okay.
and each person is different.
Right.
It's like my family sometimes, it's like, oh, there you go. You're going to play the cancer card again. I'm like, seriously?
I think that's kind of where I'd like to lead this conversation, because when you called me a couple of weeks ago, part of the situation that I told you, and and I try to be there for people that reach out to me, is that you have to understand that even though I'm not going through your situation directly, I'm also an ear, because sometimes you need to just vocalize.
Mm-hmm.
And
You need to vocalize. I got 3 lifelines that I made it. These are the people that, if I feel I'm getting close to this space, I need to call them. And you have to pick and choose that person wisely. Because like she said, your family, and kind of back to your question, your family will watch you get better.
Mm-hmm.
But they won't understand you may only be able to get better to a certain degree.
Exactly.
Like, you tear your ACL, you're not going to be probably as fast as you ever were.
No.
I got like 40%, 60, 64, I forget what it is. But it's so much heart damage that when it goes, it's just going to go. I'm not going to get too much warning. I'm not going to be like, okay, let me calm down. He said, it's just going to go. He's like, dude, you're young, but everything we did to you was designed to be done to someone in their 60s and 70s.
Yeah.
Yeah.
Question, because I know you. Do you feel that you're in here a lot?
Man, I stay up there, dude. I look out from up top here. My eyes are like up here. I live up there. I've evicted myself hundreds of times. I keep sneaking back in.
Yeah.
But that's definitely the space I was in when I called you. I was definitely hanging out on the top floor, looking out like. Sometimes I feel like I'm on the subway, and every stop is different, but it's the same stop, and the subways just keep going around. And there's a stop called Happy Stop. I keep going past it. I don't ever get off. And there's a sad stop. I fall off the train there. There's a suicide stop. I've train slowed down there once or twice, maybe 3 or 4 times. The give up stop, the fuck it stop.
And you get
I
the
think we're
crying.
on the same train. I feel that.
I sometimes find myself watching, something that is actually comedy or whatever, and I'll stop and I'll just pour a cry.
Mm-hmm.
Part of the. Go ahead.
And if you ask me why,
No
I
idea.
would not know.
No idea.
I would not know. I cry for what I went through. I cry for what I'm going through. I cry because sometimes family doesn't understand. It's you don't because you don't understand why are you going through this.
It's uncontrollable. I cry a lot.
Yeah.
I
I
could.
cry a lot. Sometimes I'll be talking to people, And something wrong with your eyes. It's the glass. Because I didn't wear glasses. I had 20/20 vision before the heart attack.
Oh, wow.
Now I can barely see.
Really?
Yeah, me too. I didn't have my this glasses when I first came.
I thought that you looked different when I could.
Yeah.
So part of the crazy thing, and we're going to talk about a little bit about, like I said, our conversation a little bit, but it reminds me, because I got a story for everything. So, me growing up, I really didn't hear the words "I love you" a lot. Didn't hear from my mom, didn't hear from my dad. I didn't. It's not like I questioned whether or not my mom and dad really loved me, but I never heard those words, right? So it has been very hard for me as an adult to vocalize these words, and I've said it in relationships. But one of the things, and I think back at this, and shout out to my boy Dean Aguilar, Mr. Real Estate Extraordinaire. That cat used to call me all the time, right? And after he would call me, he would tell me, he was like, "I love you, New. I love you." And then we're like, oh man, I got love for you. He's like, "Nah, Pat, say I love you, man." And I couldn't say those words, right? Because it was very hard for me, to say those words. And I'm able to say it now, more frequently. And I said it to you that day. Mm-hmm. And I told you, I said, I said, I don't have love for you. I love you, brother. And more than the work that I've done physically, I'm more proud of the work that I've done mentally. Because I used to be you, bro. This is why I understood you and understood that call a lot more, because I used to live in this joint. This joint used to work overtime.
Yeah, that's how I feel. I need to turn this off a little bit.
This joint used to work overtime,
focus more on
bro.
me.
This joint used to work mad overtime. Man, I used to create scenarios in my head that were unbelievable.
Yep.
Unbelievable. And it was like it was a nonstop. I couldn't control the thoughts. It's once that train started rolling, it was like choo choo.
Yeah.
One thought after another thought,
Yep.
after another thought, after another thought. And I'll tell you how I was able to work through these things. And it wasn't it wasn't something that happened like boom, like I stopped thinking about these things. I had to differentiate the thoughts versus the reality. You know what I mean? I had to think about, okay, are these my thoughts, or are these actual things that are actually happen in reality, or is it my brain that's creating my reality? And when I was able to differentiate the two between my thoughts and my reality, that's when I was able to shut this off.
Yeah.
Because shutting this off is a necessary evil, bro.
But what about when you don't know what is real and what is not?
I was just thinking the same thing.
I have to think about it.
Right now, I'm in that train where I'm like, I don't know what is true, I don't know what is a lie, and I don't know what is real and what is not.
I think that where for me, and it's going to be different for you, it's going to be different for you, it's different for everybody, right? For me, what it was I actually had to sit and breathe.
I don't know a lot of breathing. I don't.
Breathing is
your nose whistles.
I am dying to hear Audrey's nose whistles. I am dying to hear it.
I need to.
Sorry, I had to.
But breathing was a vital part of calming my nervous system, controlling my emotions, and being able to understand and just figure out what was reality.
I think that people don't address enough when they are in that cycle of like your brain won't stop. Like you're just, it's on a loop, right? It's just on a loop and it won't stop. I think that people don't give enough thought to your nervous system in that moment being completely dysregulated, and what a dysregulated nervous system looks like, feels like, and the next thing in that is what your the behavior you present acts like right in that moment, right directly afterwards. Not that this is, I feel like it's kind of the same, but maybe not. We'll see. When I've been in therapy for way too long, and because I have really bad ADHD, my loop, whatever it is, if I'm sick, I just had major surgery back in November, so there was a lengthy healing process for me where I couldn't walk. I was down for a few weeks. And when you are in that healing process, right, and then that loop starts, right, and it's on a track, it won't stop. My therapist told me to break the loop, literally just stop, breathe a little bit, because breathing really does help re-regulate your nervous system when it's dysregulated. And it sounds so simple, but breathing really does work, especially when you solely focus on your breathing. You don't focus on anything else. You're, taking a deep breath in and holding it for 9 seconds. You know what I mean? Like you're really concentrating and focusing on that. But just as an added bonus to make the loop stop, ask your brain, ask yourself, I wonder what my next thought will be. Now, as stupid as I thought, when she said it, I'm like, you're dumb. Like, I just immediately, my response, like, in my head was like, you're an idiot. Like, and I'm paying a copay for this. But I went home, and that night, because for me, it's really bad at night when I'm trying to go to bed. Like, it's just, it's horrifying.
I get that sometimes. It's awful.
Yeah.
Thank you, Xanax.
And nobody likes me when I take Xanax, so I can't take that anymore. But now when it's doing that, I will stop and I'll ask myself, I wonder what my next thought will be. And it is like a trick on my brain. My brain's like, bitch, I wonder what your next thought is going to be. What are we going to think about next? And then that becomes the new loop, right? So the loop changes. You get off that track.
Okay,
and
I like that.
And then it's almost like your brain's like, you know what? I don't know what we want to think about now. And then it's kind of easier to get off of that track. Is it perfect? Do you get back on that loop again? Yes. You get back on that loop again, but it's a little trick to kind of temporarily give you some relief. You know what I mean?
Yeah.
Just I wonder what I'm going to think about next.
I agree with that. And my trick to stop the continuous loop is like I have full blown crazy person conversations with myself. Like I'm in the car literally talking to myself.
I do that too.
All the time.
Like I'm like I am literally out loud, not just having the conversation in my head.
We all talk to ourselves out loud.
I am literally having a full-blown conversation with myself. And I'm working through my thoughts because now the new me, I don't like to push my thoughts on other people. You feel me? Especially if it's just my thoughts, right? So I'll have these full-on blown conversations with myself to work through the continuous loop until I solve it. Sometimes it happens, I'll solve that conversation in an hour. Sometimes it's 10 minutes. Sometimes I will have that conversation through the entire day. Like I will be having that same, like I'll work, like I'll go to work. I'll have the conversation while I'm driving, right? Because I don't have any distractions. And then I'll start work and I'll have a distraction. Then I'll hop in the truck. And then I'll have the same conversation over again. And I'm having I'm sitting here yelling, I'm screaming, I'm cursing, But I'm having that conversation with me rather than anybody else in my life. Because I don't want to put that on anybody else because I know these are conversations in my head that are on a continuous loop. And it has nothing to do with any.
You want to share one of those conversations?
I like to give myself another name when I'm having those conversations. So it's like I'm having a conversation with another person. It's me and Delilah. We're having a whole conversation. Yeah, that's side note. That's what I've named my ADHD. So
I love Delilah.
Yeah,
as a name.
Delilah's the best.
I'm gonna go with Lola. I like Lola. I'm gonna go with Lola.
So the kind of, look, man, everybody, and this is kind of where I wanted to lead the conversation a little bit, and just because we've all dealt with either loss or health issues or whatever. Everybody is dealing with situations differently, right? And for you, I just believe that those conversations that you have in your head is like you don't know how to slow that loop down yet. No. You haven't figured it out yet. Mm-mm. And this is what I wanted to kind of just talk about, what I've done to slow those loops down, what she's done to slow those loops down. I kind of want to talk to you about it. Have you been able to slow the train down yet?
That's my answer.
That's a no.
So
see, I have conversations with people, a type of conversation with somebody that is not there, but this is what I want to say, but I don't get to say.
Yeah.
That makes me mad.
I do that, but then I have like 11 other versions of that same conversation, and they're all based on another thing that they would say. So like if you answered me this way, well now this is what, you know what I mean?
Yeah.
And now it becomes this whole thing. But I have a question for you. So you decided when you left the hospital, right, that you weren't going to do the metformin, that you were going to take this, in your own hands and do a different diet and things like that. Did you take the same approach with the depression, or was that something that you were like, they're going to give me medication, I'm going to take it because I'm in a bad place?
When I reached out to my doctor and she sent me to a psychologist, I went in there with just whatever. I'm going to listen.
Yeah.
I'm going to listen. I learned how to take a holistic approach to certain things. I read up where some people have been able to get off certain medications after a heart attack through lifestyle and diet change. So that's my goal.
Okay.
Because of some of the damage, I won't be able to stop some medication.
Did they put you on anything for depression, or did they just think that talk therapy was the better route for you?
Okay, the depression. They diagnosed me with PTSD and severe depression, and then they gave me Zoloft, I think it was. Zoloft and something else. Mm-hmm. And I started off on that, and I saw the psychologist maybe 3 or 4 times. It was starting to get good, and then unfortunately she got ill, and she's out of the picture now. She was gone for like 3 months, so I lost contact with her. I was still going to the office and speaking with the person who was who administers the drugs. So I was taking Zoloft, and then they started giving me Valar or something. It's like I was at 200 milligrams of Zoloft, and I really wasn't feeling any change.
Did any of that make you loopy? Or you just didn't feel it because of all the other medications you were taking?
I really didn't feel it. I've dealt with a lot of pain medications.
Okay.
Well, with the depression, like with the Zoloft and the Vraylar that they put you on, did they not put you in talk therapy as well? Like, did they?
Yeah,
I was
going to talk therapy too. That helped me. That was helping. But I noticed that Zoloft, it didn't make me loopy, but it didn't. I couldn't understand what it was supposed to do.
You weren't feeling any different.
What was the PTSD? What was? Did they tell you what your PTSD was?
It's trauma.
Is the mental trauma from the
heart attack?
From everything.
Yeah.
It's just from everything. She said the amount of places that they did surgery spots at one time on my body is astronomical. They had to say we were running out of places to take tissue. Seemed like. Because they can only remove so much tissue from a certain spot. So removing all that tissue has to regenerate along with the heart has to regenerate at the same time. It's not like I just had a heart attack and I'm recovering from the heart attack, or I just had one concentrated surgery with pancreas, liver. I had like multiple surgeries at one given time.
The shock that must have done to
Yeah.
your nervous system, like
Insane.
It was insane. I was going insane to the point to where no one around me knew I was going insane because it was all up in here.
Yeah.
Yeah, nobody understands.
Nobody understood.
No.
I'm just like, I mean, I told my mom, so she would say, "How are you doing?" I said, "I'm going crazy." Don't say that, Mom. I'm fucking going crazy.